Yes, in fact, I did have breast cancer, and it was a grade 3. And they told me to get a hold of a surgeon right away. And I was lucky enough to find Dr. Beth Ann Lesnikowski with JFK. So the benefits of having the intraoperative radiation therapy, you can take the radiation and you can target it direct to the area where the tumor is. JFK is absolutely, bar none, the best place to come. Women and breast cancer is a high priority to them, and the treatment of it in a responsible way. By all means, please come to JFK Medical Center.
I was diagnosed with sigmoid colon cancer. It scared the life out of me. I didn't know what to do. Fortunately, I was referred to JFK Medical Center. I received simply the finest treatment a person could imagine. The robotic laparoscopic surgery is truly a marvel. I have no signs of the cancer returning. I chose JFK Medical Center simply because of the reputation. Have no fear. The people here at JFK Medical Center will take care of you.
I had been on a lot of medication and I had gained a lot of weight.
I tended to gain weight and had difficulty in losing it.
I was very unhappy with myself then.
I had a multitude of health-related issues. The JFK Bariatric Institute suggested gastric bypass.
After my bariatric surgery, I lost 144 pounds. The Bariatric Institute at JFK Medical Center is wonderful.
My life has completely changed. The cardiologist has told me that I've added 10 years to my life.
Tips for a healthy heart are all the things you were talked about when you were young that most of us don't do. And it's diet and exercise are the real tips. We want good healthy diets, and there are different varieties out there. Most of them all try to accomplish the same thing, which is a low fat, lower caloric intake. We want to promote exercise. We want to see people doing 20 minutes of exercise 3 to 4 times per week. And that truly is a dedicated exercise time. We hear from people all the time, well, I do a lot of walking at work, or I have a busy job, or I'm busy with the kids. And that really has been shown to be not what is beneficial for a healthy heart. In terms of exercise for a healthy heart, we recommend 3 to 4 times a week, 20 minutes, 3 to 4 times a week of cardiovascular exercise, which is treadmill, bike, walk, anything that gets your heart rate up. The key to cardiology is really prevention. We can talk a lot about ST segment elevation myocardial infarctions, and we can talk about dealing with a heart attack once it's happened. But in the ideal situation, we want to get to this before a person experiences a heart attack. And there are a lot of things we can do for that. We want to pay attention to our bodies. We want to eat healthy. We want to exercise regularly. We want to see our doctors, control our blood pressure, control our blood sugars. If there are signs and symptoms, there are tests that can be performed as an outpatient setting, EKGs, stress testing, to evaluate the heart. Look for problems before they become a much larger problem.
CCU is the critical care unit. It's on the 3rd floor, and we take care of critically ill patients. ICU is the intensive care unit, and we take care of critically ill patients there. There is no difference. They're just separated by name. The same type of patients on each side, the same nurses, the same type of care. It's the intermediate care unit. It's also known as telemetry. It's really like a step down from our intensive care unit. Med-surg is a medical surgical floor where we take care of patients that don't need a higher level care, like wearing a cardiac monitor, or they're really just post-op surgical patients there for just a short stay.
Hi, my name is Dr. Khalil Schillingford. I'm a bariatric surgeon in Boca Raton, Florida. Laparoscopic means minimally invasive, and it means using multiple small incisions instead of one large incision. 10, or I should say 20 years ago, most surgeries were done the old-fashioned open way with one large incision. Now we do surgery through a laparoscope, which is a small camera inserted through one small incision and other small incisions to use our instruments through. The end result is a quicker recovery and less risk of hernias and wound infections.